a weekly program about important issues and events in the two Virginias.
Good morning, everyone, and welcome to this edition of In Focus. This morning, we are talking about Compassus Hospice. There's a local site in Princeton. So this morning, we will learn more about hospice, some of the misconceptions about it, and we'll also hear from those who work at Compassus in our local area to answer your questions at home. Our guests this morning are Melissa Powell. She is a senior consultant with Compassus. Melissa, it's great to have you here.
Thank you. It's great to be here.
We also have Karen Hill, a nurse practitioner. Karen, great to have you as well.
Thank you.
And then Jacki McCormick, a volunteer coordinator. Jacki, great to have you.
Thank you so much. It's a pleasure.
So, Melissa, I'll start with you. Share some information about yourself and your background with Compassus.
Okay. Well, I'm Melissa Powell, and I'm a senior consultant for Compassus, and over the past 16 years, I've spent a lot of time educating healthcare providers and patients and family on end-of-life care issues. When we're faced with a life-limiting illness, it's important that we understand all of the options that are available to us. In this country, hospice is a relatively new movement, so when a patient hears the word hospice, it can be scary.
Yeah.
So at Compassus, we want our friends, our family, our community to understand that hospice is more than death and dying. It's about meeting an individual where they are in their disease process and helping them live each day to its fullest potential.
Right, and I'm glad you mentioned that, Melissa, about some of the misconceptions, because that is what we'll be talking about this morning as well. So, Karen, share some information about yourself with our viewers and your background with Compassus.
So I'm an adult gerontology nurse practitioner, and I have been with Compassus for about 1.5 years. I started out doing community palliative care, where I served patients in their homes, assisted livings, long-term care facilities in Mercer and McDowell. And in the past 6 months, I recently transitioned to the inpatient hospital palliative care role with WVU at Princeton Hospital.
That's great. Thank you for sharing some of your background. And Jacki, you're a volunteer coordinator, so tell us a little bit about yourself and what you do as a volunteer coordinator with Compassus.
Okay. I'm Jacki McCormick, and I'm the volunteer coordinator, and I've been with Compassus for 14 years in May. And so it's been a wonderful, rewarding experience, and we have right now what I call the dream team, because we've got such an amazing group of people who really have the heart for hospice, that hospice philosophy, and they really love our patients. So we're very blessed with the program that we have.
That's fantastic. So, ladies, let's talk a little bit about Compassus and just some background on it. Melissa?
Compassus is a national provider of home-based services. Services that include things like infusion therapy, home health, and palliative and hospice care. We are a team of about 6,000 individuals working in 200 different programs in 30 different states. Everything we do is focused on our brand promise of care for who I am, which focuses on a person as an individual and also as a patient, helping them to improve their quality of life in a way that's meaningful to them.
Yeah, and that's so important as well, to have that good quality of life. So how does hospice support medical needs? For those who are out there watching, maybe they have a friend, a family member, or maybe they themselves might be in need of hospice care. Let's talk about how it supports those medical needs.
Well, hospice is a 24-hour-a-day, 7-day-a-week service. So families have access to a physician or a registered nurse anytime, all day long, 24/7. We are a physician-driven company. Our services include nursing services, home health aid services. We have a social worker on staff who is available to help our patients navigate through the healthcare system. We have a bereavement coordinator who is there to provide grief support for 13 months following the passing of a patient. We also provide inpatient respite care, which is a level of care that's designed specifically for a caregiver. A lot of folks think that when you're on hospice that you will never be placed in the hospital again. However, we do have a level of care, general inpatient hospice care, that is for patients who are experiencing symptoms that we're not comfortable managing in the home. They need aggressive symptom management. So that's when we'll utilize that level of care. Also, when appropriate, patients may receive physical therapy, occupational therapy, or speech therapy services.
And is hospice care just about taking care of the patient's physical needs? From the sounds of it, not necessarily.
That's a great question. Hospice is a holistic approach to medical care. When a patient comes on service with us, we're not only there to meet the needs of the patient, but we're there to meet the needs of the family as well. When families are faced with a life-limiting illness, they need emotional support, spiritual support, and psychosocial support from an experienced professional. And patients who are able to receive this type of support, it makes all of the difference in their hospice journey.
Yeah, I can imagine it certainly does. And Karen, let's talk more about your role as a nurse practitioner and what you do to help those hospice patients.
Well, if they are already hospice, we leave it to the hospice professionals. However, sometimes patients aren't ready for hospice yet, so they will consult Palliative to come in to help manage some symptoms that they may be having related to their chronic illness. So palliative care is just a branch of medicine that we are there to help relieve symptoms and stress related to serious illnesses while patients are still wanting to seek treatment for their conditions. We are an extra layer of care and support for the patients and their family. Our goal is to try to make sure the patient has the highest quality of life that they have, and we do this by providing education to them. We do treatment decision support, because lots of times they are faced with serious news and they don't know where to go, and we can just be that extra support person for them, in addition to relieving their stress and their symptoms from their conditions.
Yeah, that's important information for our viewers at home to know about as well. And also, let's talk, Jackie, about your role. You've been with Compassus for 14 years now. How did you get involved as a volunteer?
Well, I've had, with my family, we had 2 of our family members on hospice. And quite frankly, I never knew that this position even existed. I actually had them as clients, and they advertised with me. And when I worked with the radio station. And one day I just walked in the office and they said, this position is open. Do you think that you would like to apply for this position? And I was like, well, what is that? Because I had not heard about that. When my family was on service with hospice, my grandmother and grandfather were both on hospice care. And it was just a wonderful, wonderful level of care that they provided to them at that time. And I was thrilled. I thought, this sounds like such a wonderful opportunity for me to be involved with these wonderful people in this program. I was very excited about becoming a volunteer coordinator. And it's been such a blessing to be able to work with hospice and touch lives.
Yeah, and 14 years later, here you are.
Yes.
All right, well, ladies, we have to take a quick break. We have a lot more to talk about, including some myths and misconceptions. We'll have more information for you right after this break. Good morning once again, everyone. Welcome back to this edition of In Focus. This morning, we're talking about Compassus Hospice. There's a site in Princeton, so we're learning this morning about what hospice does, and we're hearing from those involved with Compassus. So this next question will be for you, Melissa. Let's talk more about some of the myths and misconceptions. So one of them we've heard is that hospice care is only for people giving up on life.
Oh, that is a very common, misconception. Hospice care is for an individual who is no longer seeking a curative or restorative treatment, but rather their treatment goals have changed, and their goal is symptom management and quality of life. Hospice is about so much more than death and dying. It's about helping a person to be the best version of themselves so that they can live out their life to the best of their ability.
And another myth we've heard is that hospice care is expensive, and maybe folks are thinking, oh, I don't know if I can afford that. It might be out of reach for me.
Oh, that's a good one. We've heard that one as well. However, hospice care is covered by Medicare, Medicaid, and most of the large third-party insurance carriers here in our area. So what that means is for a Medicare and a Medicaid patient, everything related to the patient's hospice diagnosis is paid for at 100%. So a patient or their family, they never receive a bill for hospice care.
That's good to know as well. And another myth we've heard is that only a doctor can refer someone for hospice care.
Well, it is true. The majority of our referrals do come from physicians. However, anyone can refer a person to hospice. A hospice referral could come from a family member, from a palliative care nurse practitioner, from a member of the clergy, a friend. We can actually refer ourselves to hospice.
Well, that's good to know as well. So if someone out there is watching and they maybe want to make a referral, what's the best way to get in touch with Compassus in Princeton?
The best, you can reach us 24 hours a day, 7 days a week. And our contact information is area code 304-431-2000.
Perfect. And when is it time to actually start thinking about hospice?
Well, it can be difficult to know when it's the right time to start hospice. However, oftentimes there are symptoms and signs that point to hospice and are indicators that it may be time to have the hospice conversation with your physician. For example, if you are an individual who has had frequent hospital visits over the last 6 months, if you have a family member that you've noticed that both their cognitive and their physical abilities are declining, that may be an indicator that it's time to start talking about hospice. Someone who is experiencing continuous weight gain or just is showing decline in spite of the medical treatment that they're already receiving. All of those indicators may be pointing in the direction of a hospice conversation.
And also, how is Compassus different from other hospice providers that are out there?
Compassus, we meet our patients where they are. And so we provide care either in a nursing home, a long-term care facility, or a personal care home, or a personal residence. We have physicians on staff and who work with our nurses to manage medical care plans. We also have social workers on staff, again, who are available to help the family manage the healthcare system. Our bereavement coordinator is there for grief support. The bereavement component of hospice is one that we rarely talk about, but when a patient is on service with hospice, the patient passes away, their family has a bereavement coordinator who can follow them for the first 13 months after the patient passes away. We have volunteers who are there to lend support to our caregivers, and our social workers who are a chaplain who is also there to provide spiritual support.
Great. And then, Jackie, you can jump in here. Melissa just mentioned the volunteers as well. How do you think the volunteer aspect makes Compassus different or impacts those who are involved with Compassus?
Well, the volunteer program is a very special program because these people are here because they want to be here. So many of them have that calling, and they want to help. They're not paid. They get in there and they love those patients. They help in whatever way that they possibly can. We appreciate any and all volunteer time. For instance, we went in and we had a little St. Patrick's Day party for one of our patients. And we had music. We brought the patient's favorite dessert. And it was just wonderful. So they get in there and they do whatever they can do to brighten that patient's day, to help those families. They can provide caregiver relief. They can do visits. They can work in our office assisting our staff with administrative duties or help at any of our events. You'll see many of our volunteers at our events. They'll help with balloon releases, memorial services. So they are the helping hands of hospice, and they want to be there. And we had a volunteer, he has since passed, but he said there's just something special when I walk through those doors. He said I could just feel it. And so that really touched his heart. And they're a special group. They're a special group, and they want to touch lives.
And what are some of the roles of those volunteers who are involved?
Well, they could actually choose what they prefer to do when they come on board with us, and they can kind of dabble and try different things. They could, like I say, they could come and work in our office. They can assist me with any of mailers or the bereavement coordinator with mailers. We have an emergency preparedness book that they can assist with. They could go and just visit with patients. They could be a listening ear to the patients and do regular social visits. Some of our patients that are in facilities or just some may live alone and they don't get as much contact, you know, and so they can go and do visits with them. They can provide caregiver relief if someone, you know, just wants to go out and have a day of shopping or run errands, go to the doctor's appointments. Anything that they would need to do, the volunteer can then step in and be of assistance to them.
And maybe someone's watching this morning and they want to become a volunteer. What's the first step to do that?
Okay, they would just need to give me a call at 304-431-2000. We'll set up an appointment. They'll come in, we'll do an interview, and they can ask any questions that they want to ask. There are no, you know, dumb questions or silly questions, and just find out what information, you know, they need to know in order to become a volunteer, and then we'll proceed forward. They will go through criminal background check, fingerprinting, a TB test. It's a tuberculosis test to make sure that they don't have tuberculosis. We have to make sure that everything is safe. And then they proceed through training, and it's a 10-module training, and it's very interesting. They will learn everything that they need to know about the hospice philosophy, about hospice, and a lot of good information is provided there for their education.
Great. Thank you, Jackie, for sharing that information as well.
Yes.
And ladies, thank you. We have to take one more quick break. We'll be talking about palliative care with Karen coming up next. Welcome back to this edition of In Focus, everyone. This morning, we've been talking about Compassus Hospice. There's a location in Princeton, so we're learning more about the services it provides and some crucial information for you at home who's watching this morning. So let's jump right in and talk about palliative care. Karen, what exactly is palliative care then?
Palliative care is similar to hospice, except for palliative care is when somebody wants to continue to get treatment for their conditions, but symptom management is very important to them. They want to have the best quality of life that they can have, and that is one of our goals, is to make sure that we make sure that they are comfortable and have that quality of life. Some things that we can know when somebody might be ready for palliative care. If somebody is having frequent hospitalizations, or if they are going to the emergency room frequently, uncontrolled symptoms such as shortness of breath, or if they have depression, they're fatigued, and they're receiving medical care treatment for these conditions already. If they've been told that they have entered the end stage of their disease process, such as dementia, any cerebral vascular disorders, cancer, liver disease, renal disease, COPD, heart failure, and even septic shock. If somebody's having a functional decline, they're falling frequently at home, they're not walking as well as they used to, they've stopped eating, they're losing weight, they're starting to have skin breakdown, or even if somebody has started talking and thinking about having a permanent feeding tube inserted. Those are all good signs to, make a referral to palliative care. And just like with hospice, anybody can make a referral to palliative care. It can come from their primary care provider, it can come from the patient themselves, it can come from a family member, it can come from a physician in the hospital where I get consulted, and then we continue the outpatient services. So there's a plethora of ways to get a hold of us, and we also have the same contact number as the hospice. It's the 304-431-2000 if they would like to make a referral to palliative.
Well, it sounds like there's a number of benefits for palliative care, so let's touch on a couple of those benefits, Karen.
So some of the benefits with palliative care is when sometimes people are receiving treatments, they will have symptoms related to those treatments and that they need those symptoms controlled, or they may have other issues such as things like constipation or digestive issues, fatigue, trouble sleeping, anxiety, depression, nausea, loss of appetite, just problems with their medications in general, shortness of breath. So there's a multitude of symptoms that we can help them with.
And also, how does palliative care support the patient's family members as well? How does it help those family members?
So we are there to help provide education on their loved one's disease process and to guide them on what it may look like as the disease does progress. A lot of people are not aware of certain symptoms to expect that may be normal, so that way we are there to help with that. We are there to help families to make sure that they are aware that they are providing the best care for their family, and that we're just their extra layer of support for them and making sure they are taking care of themselves as well, because that's important that they maintain their health to be able to maintain their loved ones as well. When a family member has somebody that is sick, it causes a lot of anxiety for them to be a primary caregiver. So we are there to help with whatever needs that they may have, if it is making referrals to other outside agencies to get support in the home, or even calling their physicians to arrange complex care.
And Karen, what does the palliative care team look like exactly?
So depending on how the referral comes in, one of the first people that they may talk to is our palliative care coordinator at the Compassus office. She is there to run the patient's insurances, let them know if there's any co-pays, deductibles, or anything that they may have out-of-pocket costs. They set up the appointments with the outpatient nurse practitioner. Also, if there is an issue and the patient needs to call in to speak with the nurse practitioner, usually that palliative care coordinator is their first line of contact to reach out to us so we can return the patient's phone calls. As the nurse practitioners, we serve as a guide through their disease process to make sure every need that they have is being met while keeping their comfort and, again, their quality of life as their priority. We sit down with the patients and the families, and we develop a plan of care that may meet their needs, and as their needs change through their disease process, that plan of care may also change.
Thank you for sharing that information with us, Karen. Ladies, we have just a little bit of time left, a little over a minute. So I'd like to briefly hear concluding thoughts from each of you. What's maybe one thing you hope that our viewers who are watching this morning remember about our segment? Melissa?
Well, I hope the big takeaway is that hospice is not just about death and dying. Hospice is about meeting a patient where they are in a disease process and helping this individual to live their highest quality of life. Oftentimes in the office, as you can imagine, as a hospice team, we become very close to our patients and our families, and we'll be thinking about the family after the patient passes away and asking ourselves questions like, did we do everything that we needed to do to improve the quality of life? Did we dot every I and did we cross every T? And the way that we know that we've done that is, first and foremost, we've been able to manage a patient's symptoms. And we've also been able to open up lines of communication between a patient and a family where they're able to say all of the important things that need to be said. Things like, thank you. Thank you for being a wonderful mother. Thank you for being a wonderful spouse for 60 years. And I'm sorry, forgive me. I'm sorry that perhaps I wasn't the best husband that I could have been, or I wasn't the best son or daughter. But in spite of our differences, I'm here today and I'm here for you. And also I forgive you. In spite of all of our differences, I forgive you and I'm grateful that you're with me. But most importantly, I love you.
That's powerful.
And when we know that we've helped a family to reach this point, that's when we know that we have really done what hospice is designed to do.
Thank you, Melissa. We've run out of time this morning. Quickly, I do want to mention, though, Volunteer Month is coming up in April, so go ahead and reach out to Compassus, get involved. We hope you do. That does it for us this morning. We'll see you all again next Sunday.